Are you always thirsty, no matter how much you drink? Maybe you attribute it to the weather or your coffee intake. But what if your body is trying to send you an important signal? Excessive thirst, also known as polydipsia, is often underestimated and dismissed as a harmless side effect. But there can be much more behind it than one might think at first glance, including serious conditions like diabetes or hormonal disorders. In this video, you'll learn what polydipsia means and how it manifests. We'll explore the causes that could be behind it, from temporary fluid loss to potentially life-threatening diseases. An important question is also when it's time to see a doctor, to have the cause professionally evaluated. This knowledge could not only help you, but also someone in your environment who may be affected. So definitely stick around, because by the end of this video, you'll know exactly what steps to take if you're experiencing persistent thirst. You should take action.
Welcome to Endovision with Dr. Berger, your leading channel for insightful perspectives in the world of endocrinology. Here, we highlight the central challenges of our time: diabetes mellitus, obesity, thyroid disorders, and the essential role of nutrition for a healthy life. Subscribe to Endovision if you are ready to take your health to the next level. Here begins the path to a healthier, self-determined life.
What exactly is polydipsia? Polydipsia is a medical term that describes a condition in which the affected person feels excessively thirsty and therefore consumes unusually large amounts of fluid. While an adult consumes on average between 1.5 and 2.5 liters of water per day, people with polydipsia often drink 4, 6, or even more liters a day. Basically, polydipsia is not a standalone condition, but rather, similar to polyuria, which is increased urination, it's a symptom that can have many different causes. But what could be the causes of polydipsia? Are the causes more on the harmless side, or are they actually life-threatening conditions? It's important to know about these conditions, so you can take the right action. So stick around until the end. The causes of polydipsia are manifold. We will briefly discuss all of them next. When you sweat a lot, do physical work, or exercise, your body loses more water. To compensate for this loss, it responds with an increased feeling of thirst. This so-called physiological polydipsia is the least harmful form, where the body is simply trying to compensate for its fluid deficit. But some medical conditions also cause fluid loss that can no longer be considered physiological. We will address this in the following. Caffeine and alcohol have a strong dehydrating effect on the body, which is referred to as a diuretic effect. Coffee, tea, energy drinks, and cola contain caffeine, which stimulates the kidneys to excrete more water. This can lead to the body losing more fluid than it takes in. That the body loses more fluid when it is supplied to him. The result is an increased feeling of thirst. Polydipsia can occur especially with excessive consumption of caffeinated beverages, since the body is constantly trying to compensate for the fluid deficit that has occurred. Alcohol blocks the release of the antidiuretic hormone, ADH, which normally helps the kidneys retain water. As a result, more urine is produced, that the kidneys retain water. This leads to increased urine production, which disrupts the fluid balance. The increased thirst after a night of drinking, known as hangover thirst, is a direct result of this dehydration. Nausea and vomiting lead to significant fluid loss, especially when they last for an extended period. The body loses not only water but also important electrolytes like sodium, potassium, and chloride, which are essential for regulating the fluid balance. Especially in cases of gastrointestinal infections or food poisoning, polydipsia often occurs as a natural compensatory mechanism. The body signals through thirst that it needs to replace the lost fluid. Fever is a commonly underestimated cause of polydipsia. Even a slight increase in body temperature leads to increased water evaporation through the skin and the respiratory tract. Fluid loss through sweating. The body tries to lower the increased temperature by sweating. In the process, it loses not only water but also electrolytes. With a fever, the breathing rate often increases, leading to significantly more moisture being lost through respiration. Fever also increases metabolic activity, which raises the overall fluid requirements. When fluid intake is not sufficient, polydipsia occurs as a response to dehydration. Diabetes mellitus is one of the most well-known causes of polydipsia. In uncontrolled diabetes mellitus, a chronically elevated blood sugar level leads to what's called osmotic diuresis. Excess sugar is excreted through the kidneys, which pulls large amounts of water with it. This leads to frequent urination, polyuria, and significant fluid loss. The body responds to this fluid loss with increased thirst to make up for the deficit. Polydipsia is often one of the first symptoms of uncontrolled diabetes mellitus, and it occurs along with other signs like unintended weight loss, fatigue, and polyuria. Diabetes insipidus is a rare but serious cause of polydipsia. Here, there's a disruption in the antidiuretic hormone, ADH, which is responsible for the reabsorption of water in the kidneys. This involves either a deficiency of ADH or a reduced effect in the kidney. The kidneys excrete large amounts of very diluted urine, up to 15 liters a day, which leads to extreme polydipsia. The thirst can be so intense that those affected can hardly think about anything else. Certain medications can also trigger polydipsia directly or indirectly by disrupting the fluid balance. Diuretics, water pills. These medications are often used to treat high blood pressure or heart failure and promote the excretion of water. About the kidneys. Corticosteroids. These anti-inflammatory medications can affect the electrolyte balance and indirectly contribute to increased thirst. Antidepressants and antipsychotics. Some psychotropic medications cause dry mouth. What leads those affected to do so? Hormonal imbalances can significantly disrupt the body's fluid balance and trigger polydipsia. An excess of cortisol, known as Cushing's syndrome, leads to a redistribution of electrolytes and increased water retention. This can trigger thirst and polydipsia. Increased metabolic activity and hyperthyroidism leads to an increased need for fluids, often accompanied by heavy sweating. Hyperparathyroidism, an overproduction of parathyroid hormone, leads to an increased calcium level in the blood, hypercalcemia, which impairs kidney function and causes polydipsia. Psychogenic polydipsia is a behavioral disorder in which those affected compulsively drinking excessive amounts of water, often without any physiological need. Excessive water intake is triggered by mental health conditions like anxiety disorders, obsessive-compulsive disorder, or schizophrenia. Compulsive drinking can lead to water intoxication, where the electrolytes in the blood are diluted. Hyponatremia. This can be life-threatening and trigger symptoms like confusion, seizures, or loss of consciousness. The crucial question with polydipsia is, when is a visit to the doctor really necessary? You should watch out for red flags here, like persistent, intense thirst that you can't quench even with plenty of drinking. Accompanying symptoms such as vision disturbances, dizziness, or unplanned weight loss. An extreme amount of drinking that you can hardly integrate into your daily life. In these cases, you should definitely seek medical advice. The diagnosis of polydipsia begins with a detailed collection of your medical history. How much do you drink daily? How long have the symptoms been present? Does the feeling of thirst also occur at night? Laboratory tests such as blood sugar measurement to exclude or confirm diabetes mellitus, hormone analyses. Examination of serum and urine osmolality, ADH, is too unstable for reliable determination, and other hormones relevant to fluid balance, for example, adrenal hormones. Electrolyte status, check, to see if there is an imbalance in fluid and mineral balance. The therapy is then tailored to the specific cause. Administration of isotonic saline solution or isotonic electrolyte solutions, sometimes intravenously in the hospital or subcutaneously in assisted living facilities. Diabetes mellitus, strict blood sugar control, use of medications, and dietary adjustments. Diabetes insipidus, special medications like desmopressin to replace ADH function, restoration of a balanced hormone level by administering missing hormones, for example. Hydrocortisone, or the withdrawal of hormones and hyperthyroidism, up to surgeries for overactive parathyroid glands. Behavioral therapy or psychological support is crucial in psychogenic polydipsia to regulate drinking behavior and address the underlying mental disorder. Treating involves a slow reduction of the drinking amount is also necessary here, so that a normal drinking amount can be achieved again. Polydipsia, a symptom that may seem harmless, but can signal profound health issues. Your body is sending you signals that you should not ignore. If you react early, your chances increase to effectively treat possible diseases and avoid potential consequential damage. If you found our video helpful, we would appreciate a thumbs up. Subscribe to the channel. And don't forget to activate the bell so you don't miss any more exciting health topics. Also, share this video with friends or relatives. After all, everyone can benefit when potential warning signs are recognized and clarified in time. Thanks for watching, stay healthy, and see you in the next video.